Hi, my name is Silpa and I'm an LPN student from Bates Technical College. And today I'm going to be taking care of a 29-year-old Caucasian man who's admitted at the hospital to undergo the surgery to repair his anterior cruciate ligament that was torn on his left knee. And he has no chronic medical conditions and he's in a good health. And now I'm going to be entering the patient's room. Knock, knock. Hi, my name is Silpa, but you can call me Anna. And I'm an LPN student from Bates Technical College. And today I'm going to be taking care of you and I'm going to be educating you more about ACL, which is your anterior cruciate ligament that you torn. And you just went under your surgery. So I'm going to be talking more about that. I'm also going to be talking about the medication that your doctor prescribed for you. And I'm going to be talking about the purpose, the side effects, and the route of the medications. And can you please state me your name and your date of birth for me?
My name is Mark Lawrence, and I was born March 1st, 1992.
Okay, can you take a look at the name tag? All right, everything matches. Perfect. All right, are you allergic to anything?
I am allergic to penicillin.
Okay, yeah, that's what we have here too, so that's good. And okay, Mark, I'm going to be talking about your ACL, your anterior cruciate ligament that you torn. I'm going to talk more about that, so you have better understanding about it. So anterior cruciate ligament is one of the most common knee injuries that affects one of the main ligaments. And anterior means it's in the front, and cruciate means it's in a cross shaped, and ligament is what connects bone to bones. So yeah, the one that you torn is in between your thigh bone and your shin bones, so it's right around your kneecap, and it's mostly present, it mostly happens with athletes who play sports like football, basketball, soccer, volleyball. It's mostly common among them. They're the ones that mostly tore the ACL. So do you play any sports?
I played basketball.
Okay, that makes sense. That's probably where you got the ACL torn from. And there are surgical and non-invasive procedures that are available to repair the ACL torn. And an ACL tear usually heals in about 6 to 9 months for majority of the people. And some of the signs and symptoms of ACL are pain, tenderness, swelling that starts immediately, and then discomfort when walking and loss of range of motion, which means it's going to be hard for you to move your legs and it's going to be hard for you to walk. And so your doctor prescribed you Lortab, which is also known as Norco, and it's a combination drug, which means that it's made of two different drugs, and it's made up of acetaminophen, which is Tylenol, and then it's also made of hydrocodone. And the main purpose of the Lortab or Norco is that it's an opioid, which means that it's a narcotic pain medication that helps to relieve your pain. And it is also used as an alternating options when all the other options are not as effective. And some of the side effects of the medication is that there's dizziness, drowsiness, weakness, nausea, constipation, vomiting, and low blood pressure. And if you experience any of these side effects, you can let me or the provider know, and then we'll do something about it. And it's taken orally, which means that you take it by mouth, like you eat the tablet. And the dosage that your doctor prescribed for Norco is 10 mg over 325 mg every 4 to 6 hours or as needed. And that's the medication that you're going to be taking home. And it's like after you get discharged. And it's also known as Lortab, which is the one that you'll be taking like after you go under the surgery. So right now you'll be taking Lortab, and the dosage for that one will be 5 over 500 mg, 1 to 2 tabs orally every 4 to 6 hours. or as needed for a breakthrough of pain. And I'm going to be giving you the medication that you're going to be taking home, which is Norco, and it's the same as Lortab, but there's a slight difference with the dosage. I have written the dosage on the bottle, so it's easier for you to identify the medication. This is a medication that you'll be taking, Norco, and the dosage was 10/325 mg, and you'll be taking that home. And I also have a brochure for you which has most of the things that we talked about. It talks about what ACL is and how it's treated, and then about the medication. It's going to talk about the purpose of the medication, the side effects, and it also covers the dosage in case if you forgot to remember to read the medication. And here you go. And right now I'm going to ask you to tell me what I just told you, so I know that you have a better understanding about your condition and the medication. So
Yeah.
can you please let me know what ACL is?
Yes, ACL means anterior cruciate ligament, and
Perfect.
interior is in the front of the knee.
Mhm.
Cruciate is the cross shaped,
Yes.
and the ligament is the palm to palm
Yes.
attachment.
Okay.
And
Yes.
also, I gather from your explanation that
Mhm.
there's a very common knee injury,
Perfect.
and that affect the main ligament
Yes,
for
that's
people
right.
who practice a lot of sport, like
Yes.
football, soccer, and all that.
Yes.
Also, in order to fix ACL,
Mhm.
there's surgical and non-invasive procedures.
Perfect.
Also, this medication is an opiate,
Mhm.
and it means that it's gonna help relieve the pain that I'm
Yeah.
having on my knee, and it is used when alternating option doesn't work.
Perfect.
So this is the best option for me.
Mhm.
And the side effect that it has is dizziness, and I did hear you say drowsiness.
Yes.
I heard you say weakness,
Mhm.
vomiting,
Yes.
nausea,
Yes.
low blood pressure,
That is correct.
constipation.
Yes.
Yeah. I also have the dosage,
Mhm.
and it's written on the bottle, and I
Mhm.
could read the label.
Perfect.
So, yeah, that's what I got from explanation.
Perfect. Do you have any other questions or concerns for me?
No, everything clear.
Perfect. And
Mhm.
if you have any questions or concerns before you leave, before you get discharged from here, which is in about few minutes or few hours, and you can use your call light and you can call me and I'll come and help you.
Okay.
And yeah, I hope you feel better soon.
Thank you.
And yeah, that's all. Thank
Okay,
you
thank
for
you.
yeah, no problem. And yeah, you can ask me if you need anything, okay?
Okay.
All right, bye.